All right, we'll go ahead and get started and have people filter in. Welcome to, these are actually two sessions within one. So the first one we'll be talking about NVDRS and the data using that to examine suicide deaths with disaster-related endorsements. And then secondly, we will have a regional analysis of homicide across the Great Lakes states. And so we will go ahead and get started on that first one. Okay, can everybody see that okay? Awesome. Okay, well, we're going ahead into introducing ourselves. So I'm Morgan Sprecher. I am the Indiana Violent Death Reporting System epidemiologist with the Indiana Department of Health. And then I have my colleagues here with me, and I'll let them introduce themselves. Antigone, you can go.
Hi, everyone. My name is Antigone Kouvelis. I'm the project manager for the VDRS and SUDORS projects here in Illinois. And we're bona fide agents of the Illinois Department of Public Health, but we're housed at Northwestern University in the Vear Center for Health Policy and Economics. Thank you for having me.
And I am Stefan Gringerich. I'm with the Minnesota Department of Health. I'm the suicide epidemiologist and NVDRS epidemiologist and co-PI up here in Minnesota.
Awesome, thank you. So we want to start out with the session with talking about taking care of yourself. The session may cover some materials that can be distressing or triggering, so please take care of yourself during the presentation. You can also feel free to reach out to us anytime afterwards. Okay, so we're going to talk about the disaster exposure endorsement that is within NVDRS. So this is endorsed on both the coroner reports and law enforcement reports. This just means this was was marked as true during the time of this violent death. This is also a crisis option that's endorsed when the death occurred within 2 weeks of a disaster. So an example could be a victim lost a relative in a tornado the day before the suicide, or the victim found out their insurance would not cover damage due to their business being damaged. So for this project, crisis and non-crisis were included. And so a lot of this that we'll see is in 2020, abstractors were asked to endorse this for COVID-related violent deaths. Okay, so a little bit of an NVDRS overview. So frontline investigators, including law enforcement, coroners, and medical examiners, collect valuable information about violent deaths. However, these data are seldom combined systematically to provide a complete picture. Decision makers and program planners can use this unique source of comprehensive information to develop and tailor violence prevention efforts. So a few of the data elements can provide valuable context about violent deaths, and you can see there anything from relationship problems, mental health conditions and treatments, financial stressors, work-related problems, and physical health problems. And then as of, I believe, 2018, all 50 states plus Puerto Rico is fully funded with this grant. And you can see there the colors coincide with the year that they were added to NVDRS. I'll go ahead and we'll go into a little bit of a deep dive of each one of the Midwest states that we collected data from. So I will pass this over to Antigone.
Hi again. This is just a little background information for Illinois. Population based on the 2020 census was 12.8 million. The number of disaster-related suicide deaths that we used for this analysis were 65. And the overall suicide rate using 2020 data was 8.9 per 100,000 population. We have 102 counties in Illinois. It's a decentralized system. Participation is voluntary. Currently, we have 74 of the 102 counties participating in NVDRS and SUDORS, and that represents more than 97% of eligible deaths. We have 101 coroners and 1 medical examiner in Cook County, which is our largest county. Now for circumstance coverage, we get about 50% of coverage from LE reports and 88% from coroner and medical examiner reports. And what that means is that we just have a much harder time getting LE reports for the data, but coroner medical examiner, we have higher response. And that's it for Illinois.
Awesome, thank you. So with Indiana, we have a population of 6.8 million. Our disaster-related suicide count was 12, so we had some fairly small numbers. And we'll talk a little bit about this later. We combined some of these states so we could have a more stable rate when we're comparing across these states. Our overall suicide rate is 16.6 per 100,000 population. And then you can see our LE and CME coverage there. We are very fortunate to have some good working relationships with our data providers. Some other details about us, our county participation is voluntary, but unfortunately the centralized system that we do use is going away in 2025. So we've been dealing with getting some other vendors to kind of look at how that would work with us. And then we are a pretty rural state. So actually 34 of our 92 counties see less than 5 suicide deaths a year. And then I'll pass it to Stefan.
And in Minnesota, we have 5.7 million people. Interesting note, the flag on the upper right may be changing soon. We've got a commission looking into getting a new flag that will be a little bit easier to see, a little more distinctive. So stay tuned about that. We had 112 suicide deaths in 2020 and 2021 that were endorsed as disaster related. I haven't read through all 112 of those to see if there was COVID mentioned in them, but we had 0 prior to that. And so 2020 starts, we had 112 disaster related. So I'm going to say that they were synonymous with COVID related, those cases. Our suicide rate overall is about 13.7 per 100,000, and we get 64% of cases with law enforcement circumstances, 88% with coroner or medical examiner circumstances. We do have a team of 4 spectacular abstractors who collected all of the data that we're going to be showing today for Minnesota. And as I mentioned, prior to March 10th of 2020, which, I think was a date that we can all sort of remember, at least that time period a lot of us can remember, we had 0 disaster-related suicide deaths. So at least for Minnesota, everything we're talking about here today is pretty much COVID-related.
Thank you. Antigone, do you want to go ahead and talk about Ohio?
Some background info for Ohio. Population 11.8 million. The number of disaster-related suicide deaths for this analysis was 92. Overall suicide rate 14.6 per 100,000 population. And per the 2021 data year, 99.5% of VDRS cases had CME reports provided and 96.6% had LE reports provided. No specific counties opt out of requesting, but they do not necessarily receive reports for every case. And other details, among the 16 counties with a greater than 17.4 suicide rate, 10 were designated Appalachian counties and 5 were designated rural.
I like their flag. And then moving on to Wisconsin, they have a population of 5.8 million. Their disaster-related suicide count was 61, with their overall suicide rate being 15.1 per 100,000. And wow, they are just very even, with 69% reporting for law enforcement and coroners. And again, same thing as a lot of our Midwest states, county participation is voluntary with a decentralized system. And then kind of similar to Minnesota, 97% of their disaster-related suicides happened during COVID or after that. So here we'll take a look at kind of everything that we've been talking about, with a lot of those circumstances happening right during 2020 or shortly after. But here's a visual aid to represent that as well. like I mentioned before, we went ahead and combined Illinois, Indiana, and Wisconsin, since they had some smaller numbers. So across those 3 states, there were 124 total cases. When we're looking at the gender specific, 73% of males died by suicide when the disaster-related endorsement was checkbox marked. Compared to just a suicide maybe that didn't have that, 80% of males made up that population. Also on that graph there, you can just see the age distribution as well as the rate on the right side. So our 85 and older community died the most by suicide due to disaster exposure. Looking at marital status, the most common decedent was single and with a high school graduate or a GED. And then moving on to looking at different circumstance data, looking at the weapon types, firearms were the most common weapon used. And then looking at mental health disorders, depression followed by anxiety and PTSD were most common. And then here you can see the different circumstances there on the left, as well as percentage marked for coroner and medical examiners and anything that was marked from a law enforcement officer there. So about halfway down, you can see mental health problem was the most endorsed for both the coroner, medical examiners, and law enforcement. And just as a side note as well, that this is an average percentage across these 3 states. Some states could see maybe alcohol problem or depressed mood higher for CME or vice versa. So if you guys are interested in knowing specifically more about your state, if you are Indiana, Illinois, or Wisconsin, feel free to reach out to your state's violent death reporting system epidemiologist. And I'm sure, I guess I can speak for Indiana, happy to go into that a little deeper. But something else that came out of this, 77% of suicides occurred in the house or apartment. I think this is pretty common across a lot of the states, but some others included natural areas, hotels, or public places. You can kind of see this from the different percentage. Most information comes from the coroner or medical examiner compared to if it was endorsed from the law enforcement officer. And then lastly, again, this is an average percentage across the 3 states, but when we're looking at the different substance classes, alcohol was found most commonly, followed by antidepressants, opiates, and then so on and so forth down the line.
And for Minnesota, you see the age distribution on the left. The most common group was the 55 to 64-year age group with 27 out of the 112 cases. When I looked at the rates, it was largely consistent with this pattern, with the exception of the oldest age group, as Morgan mentioned, in those other 3 states as well, being the highest rate. The issue is with numbers the size of what we're seeing on the chart, it's hard to say if those are dependable. When you start to see similarities between those 3 states and Minnesota, then it starts to look like it might actually have been a reliable pattern and a trend. Compared to non-disaster suicides, the sex of the decedents was about the same in Minnesota between non-disaster and disaster-related suicides, or COVID-related and non-COVID-related. The racial ethnic distribution was also quite similar. Where we started to see some differences was with marital status, where you see with the non-disaster suicide, 26% of the decedents were married, as opposed to 32% of the disaster-related suicide decedents were married. Looking at the sort of the flip side of that, 63% of the disaster-related suicide decedents were either never married, separated, or divorced, versus 69% of the non-disaster related suicide. This is interesting from the perspective of, generally speaking, we see that there are lower rates of suicide among those who are married. Being married tends to be a protective factor of suicide. And with the COVID-related or disaster-related suicides, at least in Minnesota, we saw slightly higher percentage of those folks being married prior to their death. We see a similar sort of shift with the education level. So again, education tends to be protective. Reduced rates of suicide correlate with higher levels of education, but amongst the non-disaster, when we compare the disaster and the non-disaster suicide distributions, we see that the disaster-related suicide, 59% of those folks actually had post-high school education. So this is any level of education after high school. So it could be an associate's degree, a bachelor's degree, all the way up to a PhD or a terminal level degree. So higher rates, we can go to the next slide. Point is, a little bit of a different sort of pattern when we look at the marital status and education. Again, looking at weapons used, what caused the actual fatal injury, this is at least rank-wise similar to what Morgan just shared, with firearms being the most common, followed by suffocation and hanging, followed by poisonings. And it's also quite similar to what we see across the board in Minnesota with regard to the percentage of suicide deaths occurring by those different mechanisms. Similar story when we look at the mental health diagnoses. Depression and anxiety are the most common mental health diagnoses among suicide decedents in Minnesota in general, and that was also the same with the disaster-related suicides. Next slide. With regard to circumstances, I want to point out and highlight that these are all likely underestimates, because there are lots of places along the sort of data path where we might miss that somebody had one of these circumstances present at the time of their death. That said, if we rank order these and compare those to, again, what Morgan presented and what I see when I look at Minnesota in general, these are largely consistent. There's a little bit more evidence of depressed mood among these COVID-related or disaster-related suicides, slightly higher prevalence of history of suicidal thoughts or intent disclosed. And part of that might have been just in general, the mood around 2020, particularly early 2020, at least in my experience, was a little more depressed. With regard to sort of comparing the coroner medical examiner data to the law enforcement data, we see that coroners and medical examiners more often capture these things. So there are higher prevalence of each of these circumstances, with the exception of eviction and financial problem. In those two areas, we actually saw a higher prevalence of law enforcement reports finding those stressors, those circumstances related to these deaths. And then also to note that the large majority occurred in houses or apartments. Again, with stay-home orders and things like that through 2020, people not being able to go out to closed restaurants and such, that's not unexpected. Also, about 75 to 80% of all suicides in Minnesota occur in a home or apartment. So not a whole lot of difference there between disaster and non-disaster related. Next slide. And with regard to toxicology, alcohol was the most common, followed by marijuana, followed by antidepressants. This pattern is largely consistent with what we see in Minnesota across the board with suicide deaths. The prevalence of alcohol is probably related to just the ability or the availability of alcohol in our society. Marijuana, similarly, it's a little bit more available to people than some of these other items. Quick note on toxicology, these are not the substances that cause death. This is just what was discovered in a person's toxicology results at the time they died or at the time that the toxicology sample was taken. Some of these may have been prescription, some of these may have not been prescription related. We haven't teased that out. This is just the raw prevalence of those substances from toxicology data. And again, very similar to the non-disaster related deaths that we see in Minnesota.
Stefan, I have a quick question. What is the legality with marijuana in Minnesota?
At the time of these results, it was not legal. It has since become legal. And we'll be tracking very closely how these numbers change. The trick
I'm wondering if that's why it's at 15% versus when we just looked at ours. I think it was a little further down the line.
Right. So yeah, state by state, the laws are clearly different. And I don't know exactly when did it become legal in other states? Do we know off the top of our heads?
Indiana is not. Ohio, ooh, I can't remember. Michigan.
Illinois has been for a while,
Currently,
so Antigone could probably give us.
Yes.
Interesting. Interesting to look at. Okay, sorry, that was a side tangent. Okay.
So for the Ohio disaster-related suicide data, Allie just answered. Illinois was 2020. Thanks, Allie, a member of our team. In Ohio, 92 total deaths for the time period that we're looking at. 73% were male, 93% non-Hispanic white, 58% between the ages of 45 and 74. 47% with a high school degree or a GED, 47% married. And as we saw with the other states, most injury and death occurred in a house or apartment. Most common weapons used, firearm, hanging, strangulation, suffocation, and poisoning. Next slide. And here we have the circumstances data. As you can see, mental health problem was the most endorsed, both for CME and LE reports. And depression and anxiety disorder were the most diagnosed mental health problems. Just to note, 20% had no known CME circumstances and 10% had no known LE circumstances. And for toxicology, as we saw again, in the other states, alcohol was the most prevalent, followed by antidepressants, marijuana, and opiates. And 28% did not have toxicology reports available.
I believe Stefan is going
Is this my slide? Okay.
Yes.
So to sum up, looking at some of the key highlights, male suicide percent was lower in disaster-related suicides compared to non-disaster-related suicides. So there were fewer males percentage-wise among the disaster-related suicides. Consistently, we found that mental health problem was the most endorsed circumstance. And this was, again, consistent across all states, in some cases higher than 50% of the decedents. Alcohol was the leading substance. Again, part of that is probably due to the just pervasiveness of alcohol in society. We know that alcohol sales increased at the time of the pandemic. There are lots of reports on increased levels of alcoholism. And in fact, in Minnesota, at least, we saw increased rates of alcohol attributable deaths as well in 2020 and 2021. And overall, across states, firearms accounted for the largest proportion of these suicide deaths. Again, consistent with what happens in non-disaster related deaths as well. A couple places where we think we could look more in depth is comparison to pre and post-COVID suicide deaths to determine how some of these disaster related circumstances might be used for prevention efforts, to look a little more deeply into common themes across those disaster related deaths that we've been talking about today. And in terms of limitations, just
sorry.
Go ahead, Antigone.
I had trouble unmuting there. Some of the limitations that we found were endorsements come from coroner, medical examiner, and law enforcement reports. Sometimes we don't get a lot of information to be able to endorse the circumstance part of the data, so it's very difficult. We also had small numbers, so we had to combine, as you saw, years and states in some cases. The variable was added in 2013, but rarely endorsed before 2020. So the majority of these deaths were definitely due to the pandemic. And then there's a variation in abstractor experience. Interpretation may not be the same state to state. And this could also lead to undercount or overcount of disaster-related suicides. One other thing I wanted to point out is how rich a data resource the NVDRS data is, especially with the narratives. I was able to read through the narratives for Illinois and found the common themes to be isolation, not being able to go to work, so job problem, financial problem, and of course mental health, which was indicated in the data. But it also speaks to the importance of being able to read the narratives and do qualitative analysis in addition to the quantitative when you're looking at the data.
Awesome, thank you. I know this is 10 minutes for questions, but I want to be mindful of Charlie's time as well. So we'll do about 5 minutes. Let's see. I think I saw someone's hand. I don't see any in the chat, but I thought I saw someone raise their hand with a the little emoji thing. But if not, we can go ahead and move on to Charlie. And then if there's any in the chat later, we can just do all the questions at the end as well.
Sounds good.
All right, so I think you guys are looking at my slides now here. You actually did get a question in the chat. Do you want to answer that quick or?
Oh, let me see. Oh, is the raw data available to do county level analyses? Each state is different, but with Indiana, death data is public information. So but there are some parameters in place, so we cannot release line by line data. But if there's something specific that you're looking for, I would just say reach out to your state's epidemiologist, and they can kind of work with you if you're looking for something specific. Stefan and Antigone, I don't know if you had any other thoughts.
I would just add that, in Minnesota, I think we had the highest number of the COVID-related or disaster-related suicide deaths. There were 112 total spread out over a 2-year period. And that's across 87 counties in Minnesota. So you start to do the math and realize there's going to be a lot of counties that you can't do much analysis on just because of the numbers. Some of the larger counties like Hennepin County in Minnesota or Cook County in Illinois, you could probably do a little bit of analysis. And I think just echoing what Morgan said, it's state by state. The rules are different about what's shareable. But the CDC does have a restricted access data set that you can apply for. We can pop a link to that in the chat. There are, certain criteria that you have to meet, and you have to tell them kind of what you're planning to do with the project. But you can get individual level data that way. That's one potential way.
I'll go ahead and put that the RAD link in the chat for anybody that wants it. But without further ado, Charlie, feel free to go ahead.
All right, thanks, Morgan. So I'm Charlie Vear. I'm a research analyst. I currently work at the Medical College of Wisconsin. My work largely focuses on the city of Milwaukee, and I work closely with the Milwaukee Police Department on our violence-related data. Another hat I wear is I also chair the data committee for the Midwest Injury Prevention Alliance. So as part of that team, we have put together an analysis looking at homicide across what we're calling the Great Lakes states, but kind of interchangeable with Midwest here. So just to get us started with a bit of an introduction, I know we just heard this presentation that was using NVDRS data. So this is a little bit different. We were using the death record data, so it is a little less detailed in terms of contextual factors that we have available there. So this analysis is a little less specific on some of those. We can't pull out specifically COVID attributable homicides, things like that. But we are looking at those over the COVID period. So just want to give some clarity on kind of what was included in this study. So we have the Great Lakes states, which is being defined as Michigan, Ohio, Indiana, Illinois, Wisconsin, and Minnesota. And again, I might say Midwest kind of interchangeably with that, but I just wanted to mention those are the states that are included in the data I'm about to show. So we've seen an increase in homicide during the COVID pandemic that was reflected in each one of our states. So we were discussing that and decided to see what it looked like if we aggregated across our states. And And then looked at homicide from 2019 through 2021. And then this presentation is going to look at some of those trend lines for those demographics, as well as contextual factors such as weapon type information of these homicide incidents. So the methodology, I kind of mentioned some of this. We used our state death records to collect our demographics and other contextual information on these homicide deaths. We also collected population estimates to do our rate calculations. That's used the U.S. Census Bureau population estimates. We also did some just crude rates by per 100,000 population. So that's how we do most of it. There's a couple of spots in here where we don't have this as consistent of population estimates. So for like a education type and a couple of other like marital group, we're just showing those by proportions. So a few of the slides will just be showing proportions. So I'll point those out. Just get started here. This first figure is just looking at an average homicide rate across each one of our states over the last 3 years. So just for folks to kind of get oriented to kind of how each one of the states sits. Our highest rate is in Illinois, followed by Indiana, then Ohio, Michigan, Wisconsin, and then Minnesota. Kind of goes in a counterclockwise circle there. We if you compare Minnesota to Illinois, it's the rate is almost less than about half of what we see in Illinois. So a bit of a difference when you look at each one of these states individually as regards to their just general crude rates. Here's looking at some trend lines. So this is just by year. I did include in this slide, this is one of the few slides that includes 2018 data. We pulled this data previously for another presentation. So I just kept that in here so we can look at these trends from 2018 through 2021. You can see here the big bump happens 2019 to 2020. This thicker orange line here is the aggregated rate across each one of the states. So that one went from 6.0 in 2018 to 8.6 in 2021. So that is about a 43% increase comparing those two time points. Looking at the bump here from 2019 to 2020, that was about a 37% increase looking at the Great Lakes states combined, and then from 2020 to 2021, not quite as high of an increase, but still increased about 6%. This next one's looking at quarters, so we can see a little more specifically kind of when COVID hit and some of the seasonality trends of this. I know there's a lot of lines going on here, but again, this thicker orange line is the Great Lakes states. You can see some pretty obvious increase here from quarter one. This is 2020 to quarter two and quarter three. So about middle of 2020, we saw about our peak 2020 rates for that year. And that continued on to 2021. Again, we usually see this in most of our states have a kind of an increase to our warmer months and a decrease in our colder months. So the Midwest, we do have winter here. So that affects our homicide rates. So this shows a little bit more on that. And not to get too crazy with it, but this is the months. I know this is a lot of lines kind of dashing around here. This really just highlights that increase we saw from March of 2020 to July of 2020. So over that few month time period, we actually saw a doubling. This is our per month rate was about 0.44 to 0.89 over those I think 4 months. So pretty substantial increase in a pretty short time period. And then again, you can see some of the seasonality trends of this. For 2021, we got pretty close to the same peak that we saw in 2020. So pretty similar trend line for both 2020 and 2021. So next, we're going to look at some of these graphs. These are just arranged. Each one of these bars here is each year. So this is 2019 to 2021. And then I have my different demographic groups shown along the bottom here. So looking at our males, saw a pretty substantial increase among our males by 46% and then 43% by our females. I just wanted to highlight comparing the 2020 and 2021 rates here that there was actually a higher increase from 2020 to 2021 for our females. That increased by about 14% for our females and then up 3% for our males. So the increase didn't slow down quite as much as it for our females as it for our males. Looking at it by our age groups, here you can see the highest proportion of our homicide homicide age groups are from 15 to 44. That's a fairly large age group, but proportionally to these others it's quite substantially higher. Looking at some of these individual ages, though, I just wanted to highlight here the only group we saw a decrease in was the 0 to 4 group, comparing 2019 to 2021, from 3.3 to 3.0. Every other group did see an increase across every single year over the last 3 years, even our 65 plus. So this does seem to increase across pretty much every age group, and then proportionally comparing looking at 10 through 14, that went from 1.0 to 1.8. So although it's not a substantial proportion of the overall homicides, that specific age group did about almost doubled over that time period, and is still increasing. So just wanted to call attention to that as well. Moving on, our next graph here is race. So you can see our highest rates are among Black individuals. Wanted to call attention to the percent increases we see here. So for Black individuals, it increased 55% comparing 2019 to 2021. For Asians, it was actually a little higher with 58%. For our white individuals, that went up by 29%, and then American Indians and Alaskan Natives was the only group we saw a decrease in over this time period. Moving on to ethnicity, here we see actually one of our demographic groups see a decrease from 2020 to 2021. So Hispanics saw a slight decrease over that time period, but still an overall increase comparing 2019 to 2021. And that is all I wanted to highlight there. Looking at education, this is where we're switching to our proportions. So in this gray box to the right, I just have a proportion of the total population that belongs in that group. So this is pulled from our census estimates as well. You can see that our less than high school folks are, overrepresented in this in our homicide sample, only 9% of the population, but in 2021 making up about 30% of our homicide deaths. For our high school and GED, again, still somewhat overrepresented. And then you see some underrepresentation as you get to some college and higher education. As far as interpreting the trends, fairly flat, but we do see a bit of a decrease here in this less than high school and a bit of an increase in this greater than high school. I think this would take a bit more of a deep dive, try to figure out what's going on there. I know there was a lot of shifts just in education in general over the COVID period, so that could have potentially affected some of these numbers. But yeah, that's how the education numbers look here. And then I did want to just note here that we did not include Michigan data in this graph. So this is one of the graphs that did not include all the states. This is lacking Michigan data. Looking at it by marital status, really not a whole lot of change as far as the trends, but looking at our proportions, overrepresentation of those individuals reported as single, kind of underrepresentation for those reported as married. So that is how that data is showing. Something else that we looked at was the weapon type. You can see here that the proportion of our homicides that the firearm as weapon type has pretty substantially increased over the time period of the study. So we're from 75%, so about three out of every 4 homicides with a firearm, to 84%. So up almost right around 9% for that. Our other types, you see a bit of a decrease. Again, this being a proportion means that there's going to be less of these other types if that type is increasing. So it does appear that more of our homicides are happening with a firearm. And then also wanted to mention on this slide that this one, it does not have Ohio data, and this one as well does not have Ohio data as well. So this last one's looking at location type. Here, the really only place you see there's a decrease is the home, and this does not technically mean like the homicide victim's home. This just means in a home, like in a residence of some sort. So it does appear that although these other groups, it's really hard there's not really a whole lot of interpretation with regards to kind of some of these trend lines. It does appear that just this less homicides are occurring in the home as we move forward in these years. So likely happening elsewhere in, public spaces or, other places outside the home. So that is what I have for the data that we pulled in. Just want to have some closing notes here for you. So this data does show that we've seen an increase in homicide across the Great Lakes states from 2019 through 2021. For a lot of our demographic groups, the homicide rate was just as high or higher in 2021 as it was in 2020. This could suggest that some of the risk factors brought on during the COVID pandemic, where we saw that initial increase, were still prevalent are present in 2021. And I know that a few of the states were able to submit some preliminary data for 2022. We did not include it with this study because we didn't have enough states with that ready. But based on some of that preliminary data, there does seem to be a sustained, that the 2022 numbers do seem pretty similar to what we're seeing in 2020 and 2021. So it's still kind of that remain at that kind of high level, not a real increase or decrease, but kind of just remaining there. So I just want to give folks some awareness about that. And then obviously this is a very high level study. Can't really do very much detailed analysis, just pulling information from the death record. So, looking at specific time components here of different, policy implementations or, reduction to social services. Some studies that are more specifically looking at those things and their impact on homicide are needed to really, draw any type of conclusions to kind of why some of these things are happening and why we saw this increase in homicide. So that is all I have for my presentation, and yeah, happy to take any questions if folks have any. So we got some message in the chat.
Yeah, it looks like one of the sorry, I have like a million tabs open when you're doing this. Clearing up about the how is the state with a high percentage of LE reports getting those reports? I think we kind of misexplained what that meant. The LE circumstance coverage and CME circumstance coverage, what that means is when the abstractors get those reports from LE or CME, there are certain marks that we have to put in NVDRS to mark as complete for the incident. And so what that is saying is that 99.5% of LE reports that they received, they completed in NVDRS. Does that make sense? And I think so it's not necessarily that out of the, say they have 100 LE agencies, they're receiving 99.5% of reports. So that's kind of confusing. That's our bad on the wording with that. But if you have further questions, feel free to reach out to us as well. But I don't see any other questions. Feel free to message us directly as well throughout the rest of the conference. I know we have about 3 minutes left. After this will be a 15-minute break and then another breakout session. So you guys can take a break and then feel free to choose one of the other breakouts, but we will stay on if we see any other messages in the chat pop up. But if not, thank you for coming. We really appreciate it. And again, these slides will be available the slides are already available on the conference drive setting, and then the session is recorded and will be on the website after. Oh, Mary, we're used to it at this point.